nerve physiology. So today we'll start a second part of our nerve physiology. एक्शन पोटेंशियल हो गया था, ऑप्शंस एक्साइटेशन contraction coupling all of them हो गया था. So today we'll talk about the various periods which occur during action potential, or various stages of excitability which occur during action potential. Okay, so first one of the important period which we encounter during action potential is refractory period. What does mean by refractory? So inability to respond to the stimulus. When we apply threshold stimulus for enough time, then also nerve is not able to respond. That is what refractory period we call. So they are unresponsive to the any type of the stimulus. Literally meaning of the refractory period. So if you see the type of the refractory period, we divide it into two. One is absolute and second is relative. In absolute, no matter whatever strong stimulus you applied, whatever intensity or whatever duration of the stimulus you applied, nerve will not respond at all. So it is a absolute, there is no response will occur during this phase. That is called absolute refractory period. Second is relative refractory period. Here nerve is refractory, but if you apply a very strong stimulus, like we can call super threshold stimulus, then it might respond, but it will not respond as same as that of the action potential, or sometimes it will be less than action potential, but it will respond. So some changes you might see in membrane potential, and that is called relative refractory period. So first we'll see absolute refractory period, how this happens. So uh, no, paralysis refractory period is normal. Okay, it is not a disease. Okay, so let finish topic and then you can think about all those things. Okay, now how that refractory period develop? Once you develop the action potential, so apply stimulus, sodium channels open, sodium enter, and it go reach to the firing level. And at the level of the firing level, um, it opens voltage gated sodium channels, and this voltage gated opening of voltage gated sodium channels, that is AM gate sodium channels. These are responsible for development of action potential or depolarization phase. During this phase, as the all sodium channels has been open, even if you apply any stimulus during this phase, there are no more sodium channels available to open. So now will not respond at all, because now normally respond with all or none response. Yes, Tanaya. Yes, Tanaya, Vijay. Tanaya, Vijay will not be able to rejoin webinar. Okay. So during this phase, as the all sodium channels has been open, even if you apply stimulus, there is no sodium channels available to open. So that is the first stage. So during the depolarization phase, nerve is completely refractory. Now come to the repolarization. When during downstream is going, during that time, these sodium channels become inactive. They are close but inactive. So during inactive phase, even if you apply any stimulus, this will not open. Active and close is different, where they are responsive to stimulus, and if stimulus is applied, they will open. But in inactive phase, these sodium channels will not open even if whatever stimulus you are giving. And that's why during in early repolarization, almost all sodium channels are in a phase of inactivation. So during that early repolarization phase also, there is a water stimulus supply, sodium channels will not open at all. And that's why when we are talking about the action potential, during this phase, it is completely repolarized, and during this early phase, up to this phase, up to this cycle, whole, okay, from this phase to this phase, sorry, during up to this phase, or you can go something up to this phase, the nerve is completely refractory to any type of the stimulus. Okay. Now after this phase, absolute refractory phase, uh, these voltage gated sodium channels start becoming little bit active, and they will able to responsive to the stimulus. But at the same time, the voltage gated potassium channel has been already opened, and that's why, so sodium, even if you give stimulus, sodium opens, but same way the potassium is also moving out, and that will nullify the effect. And that's why we need to apply a stronger strength of the stimulus, so that more sodium ions will be open, and that can show some changes. And that's why this comes under relative refractory phase. Similarly, during after hyperpolarization, during that time, so almost all sodium channels has been active, and almost not all, but almost maximum potassium channels is also mm, closed. But during that phase, also memory potential is a little bit lower than the normal, and that's why also during this phase also, nerve is little bit refractory to the normal strength of the stimulus. You need to apply little bit higher strength of the stimulus. Yes, Apurva. Rohan, action potential is always in a maximum condition. If action potential is formed, it will form with a maximum strength, or it will not. ऐसा नहीं होगा कि एक बार high action potential हो गया, दूसरी बार low हो गया. It will not be there. If action potential is generate, it will generate maximum, or it will not generate at all. And that is what we call it as a all or none phenomena. Okay, then now come to the refractory period. As I said, there is a sodium channels get activated, but at the same time, potassium channel is also open. So we need a more stimulus to open those sodium channels. And at this during after hyperpolarization, memory potential is anyway downward. That's also example of um, hyperpolarization. So main reason for refractory period is uh, inactivation of the sodium channels. Then come to the one of the condition where the supernormal period, where even subthreshold stimulus is also applied, then also it respond, and this is occur just before the hyperpolarization, where the memory potential is a little bit higher, and almost maximum potassium channel has been close. And when that time stimulus applied, so to raise the memory potential, which is above the minus 70, to go to minus 55, it will be easily, it can goes even with the subthreshold stimulus, and that can initiate action potential. And that is called supernormal period. The supernormal period usually we'll see uh, during this phase. This is the phase where we'll see supernormal. So here the um, memory potential goes below minus 55, but above the minus 70 during that phase. And there is a subnormal period which will occur during hyperpolarization phase here, because of memory potential is below the normal, less than normal resting memory potential. So we need to apply a little bit extra stimulus, little bit more than threshold stimulus. and that is called a subnormal period. So these are different periods which can we experience in action potential. Now next is a accommodation. It is a when we keep on stimulate the any membrane with a threshold stimulus continuously, and it doesn't reach to the firing level, and no action potential is produced. So first we'll give the stimulus with subthreshold stimulus, and slowly हम increase करते जाएंगे. And what will happen in this case? This is called like a nerve get adapted to those stimulus. So suppose threshold stimulus is 5 volt. So from to raise the memory potential from -70, it take up to take up to -55. We need to stimulate the nerve with a 5 volt current. But suppose we were stimulating with a 2 volt, 2 volt का stimulus दिया, just local potential form हो गया, and then it start again coming down. Then again I will apply for 2 volt, and then again it goes up, and then again it goes down. Again apply 2 volt, it again goes up and goes down. After sometimes 2 volt के बाद मैंने 3 volt दिया, 3 volt के बाद 4 volt दिया, 4 volt के बाद 5 volt, ऐसा बढ़ाता जाऊंगा. Even if I'll go beyond 5 volt also, that is above the threshold stimulus also, that during that phase also, it nerve doesn't respond, though we are applying above the threshold stimulus. Because of the previous stimulus, the nerves is get adapted. And how it get adapted? Because some portion of the voltage gated sodium channels, even they start opening below firing level, and this sodium channels start getting inactivated. Or just have 2 millivolt, they get 3 millivolt, more and more sodium channels start getting inactivated. And when you reach up to the threshold stimulus slowly, during the threshold stimulus, hardly any sodium channels are available, or the very less number of the sodium channels available, which can respond to that threshold stimulus. And because of that, memory potential will not go because of the inactivation of the partial inactivation of the sodium channels, and this causes adaptation. Second reason for this accommodation is that when you are keep on raising the memory potential to counter it, potassium channel is also open, and that reduces the change in the memory potential when subsequent stimulus is applied. So this is one of the mechanism of accommodation where now we stop responding even if we apply threshold stimulus. Then there is infatigability. We say fatigue is a property of muscle, so infatigability is a property of nerve. Now never get fatigue. So whatever you will apply stimulus, now will always respond. कितनी बार भी आप उसको दे दो. But if it has to be threshold stimulus, and it is because of having long refractory period. आप देखोगे तो so refractory period range from the depolarization phase till the early repolarization phase. So इस phase तक तो refractory होता है. That is enough time for the nerve to recover from the action potential. What changes occur during the action potential, and that's why they are infatigable. So जब भी आपको fatigue होता है brain में, it is not a fatigue of nerve, but it is fatigue occur because of synapses. Then come to the local potential or electrotonic potential. This is जैसे मैंने बताया कि action potential always occur with all or none law. So it has to be when threshold stimulus is applied, it will generate action potential. If threshold stimulus is not applied, it will not generate action potential. Now, what will happen if we apply stimulus and that doesn't develop action potential? इसका मतलब ऐसा तो नहीं है कि nerves में कोई changes होते ही नहीं. Now does has a changes, and those changes which occur are very locally, and that can either increase in the memory potential or decrease in the memory potential. And in both sides, it can occur when we apply it about a subthreshold stimulus. And these potential changes which occur is usually referred as a electrotonic potential, or also called as a local potential or local response. Okay, now we'll see when we apply the stimulus, it can either open the sodium channel, calcium channel, potassium channel, or chloride channel. So when the sodium channel and calcium channel open, it will raise the membrane potential. So it will increase the excitability of the nerve for the subsequent stimulus. And this is like it going towards the depolarization phases. So this is called depolarization changes. And this type of the potential usually called as a cate-electrotonic potential. means towards positivity. Second type, when it opens the potassium channels or chloride channels, it will decrease the membrane potential. It is causes actually hyperpolarization of the membrane, and this is usually increase resistance for the subsequent stimulus. And this type of the potential changes is called electrotonic potential. Okay. Now these are also referred as a graded potential because it changes from the कभी 1 मिलीवोल्ट चेंज हो गया, 2 मिलीवोल्ट, कभी 4 मिलीवोल्ट. So there are different with a graded stimulus it can increase. So with the magnitude of the stimulus we can increase the or change the response of the this graded this potential, local potential. That's why it is also referred as a graded potential. So graded potential, electrotonic potential or local response, they are all synonymous, or they all talk about the same. Now, there is some difference between action potential and graded potential. Action potential is used when we need to conduct the impulses. Graded potential, when any type of the stimulus applied, what a change occur in the membrane potential. If it is not action potential, then we call it as a graded potential. So there is some basic difference between these two things. One is amplitude of graded potential is varies depend upon the intensity of the stimulus, while amplitude of action potential is always constant irrespective of the intensity of the stimulus, but stimulus has to be threshold stimulus. Second thing, these are different membrane potentials, graded potential. If we keep on stimulating repeatedly or nearby 2-3 sites will stimulate simultaneously, they can add up and they can increase more response in graded potential. This is called summation is possible in the graded potential. So summation can be in opposite direction. कुछ graded potential negative direction में कुछ positive उनका भी summation होगा. All are in negative direction, then also it is positive summated, or all up towards the positive direction, then also it can be summated. So summation is possible with the graded potential. But in action potential, as it has a maximum response, there is no chance to increase more than that. So अगर कहीं भी action potential generate होता है तो it will be with maximum response, so it will never get summated. So you cannot summate कि 2-3 action potential simultaneously हो गया तो बहुत बड़ा action potential generate होगा, so it will never get summated. Next response is gradient potential can be in the both directions. Either it can be towards the depolarization, like membrane potential goes towards the zero, or it can go away from the zero. So it can be depolarizing or it can be hyperpolarizing. Well, action potential always and always depolarizing. Okay. Then graded potentials can generate spontaneously or in response to the any physical or chemical stimulus. But for action potential, there has to be a threshold stimulus. So it is always in the response to the stimulus. So it cannot be like अपने आप action potential generate होगा. The next important property is gradient potential cannot conduct as a form of the impulse, because as it moves from the one direction to the other direction, its intensity start decreasing. While action potential is a one of the tool to conduct the impulse by the nerve. So why? Because it's conducted in non-decremental fashion. So यहाँ पे इसकी जो +30 तक जाएगा तो in continuation में भी it will go in the same direction. It will not change in the potential. That's why it could able to uh, conduct the impulse. Another example of gradient potential, motor input potential, postsynaptic potential, receptor potential. These are all examples of gradient potential. Well, example action potential. Motor action potential occurs in nerve fibers, skeletal muscle, or cardiac muscles when they perform any action or when they apply with the threshold stimulus. That these are the example of action potential. Now, few things we need to understand. If you see this is a going towards the positive. So if we apply very small stimulus, there is a very small changes occur. As I keep on increasing the strength of stimulus, the changes will be keep on increasing. So when we are applying the threshold stimulus also, that also generate usually a graded potential. But that graded potential reach up to -55 millivolts. So whenever any graded potential which goes up to -55 millivolts, that we can refer as a local response. Okay, and once it goes to -55, it will open voltage gated sodium channels, and that will uh, generate the action potential. One of the very important difference between gradient potential and voltage gated sodium, action potential is presence of voltage gated sodium channel. So action potential is developed only opening of voltage gated sodium channels, while gradient potential can occur either because of voltage gated sodium channels, or it can occur either because of mechanosodium channel, or it can occur because of ligand gated sodium channels, or ligand gated calcium channels, or mechanically gated sodium channels, or voltage gated calcium channels. Whatever this, so any type of the channels will open, will can generate this local response. So other part of local response is hyperpolarization can occur. So that is also in the graded fashion it can goes, but this hyperpolarization never can ever form into action potential. Okay, and these also can open either can occur because either of opening of the potassium channels. That can potassium channel can be voltage gated potassium channel, or it can be mechano gated potassium channel, or it can be a ligand gated potassium channel. Similarly, it can occur because of opening of chloride channels. That can also voltage gated, mechano gated, or ligand gated. So the different stimulus can also form these, but action potential is formed only when it opens the voltage gated sodium channels. So now we'll come to the conductivity of the nerve. So transport of the action potential from one part of the nerve fiber to the other part of the nerve fiber, or conduction of the depolarization from one part of the nerve to the other part of the nerve fiber is called as a propagation of the nerve impulse, or conduction of nerve impulse, and it is one of the important property of the nerve which we utilize in our body, and because of that CNS is utilized to communicate the rest of the body through this conductivity. Now, how does conduction or action potential propagate in the nerve? First, we'll to understand this propagation. First, we'll think about the unmyelinated axons. Now, what happens? Unmyelinated axon has a wrapping with the Schwann but it is not firmly. So, the both sides of these fibers will expose to intracellular fluid and extracellular fluid in continuous. So the fluid which present inside the axon is called intracellular fluid. Fluid which present near to the outside the axon, we call it as a extracellular fluid. Okay, so both will be present. And now what we'll do, we'll apply here a threshold stimulus. Once we apply threshold stimulus, it will generate the action potential. Now here action potential generate. Now if you see here, the outside is positive, inside is negative. Now sodium start entering into the cells, and now it inside will become positive, outside will become negative. Now what happens when these nerve fibers, this happens when sodium start entering here, and this will become positive. Now this, as a this nearby area, so this sodium will also spills to the nearby area. So it goes here at it. So this sodium goes here, and sodium goes here, and now it will become this side also positive, and this side will also slowly raise the membrane potential and reach up to the minus 55 millivolt, and now this side also generate the action potential. अब यहाँ पे action potential generate हो गया. So it looks like the current is flowing, sodium idhar gaya, idhar aaya. It is like it is flowing the circular current, and then because of the circular current is now fibers is moving away, and our action potential is moving away from the site of stimulus, and this is how it keep on propagating along the length of the axon. Okay, but this happens in experimental one. Now you see here also it going in this direction also, and it is going in this direction also. But this usually occur in experimental animal, और हम experiment करते हैं तो. But in living animal or living being, we cannot stimulate the nerve in center. हमारा जो nerve brain में stimulus होता है, it can stimulate the axon hillock, or it can be receptor. So this is usually stimulate the one end. So suppose हमने एक end पे इसको stimulate किया, हमने अभी center में stimulate नहीं किया, and that generate action potential here along the cell membrane. Now, because of circular movement of the current, this sodium ion moves here, and these also become positive, and it also generates action potential here. Okay, this is how the current from stimulus it moves from one direction to the other direction. Now, what happened when it moving from this direction to the this direction? Now, यहाँ पे action potential generate हो गया, यहाँ का action potential चला गया, but sodium also moves this side. But here the voltage gated sodium channels are now refractory. And because of that refractoriness, it will not able to generate the action potential here, and action potential generate only here. So from यहाँ से यहाँ गया, यहाँ से यहाँ गया. जब यहाँ पे action potential generate होगा, तो that will again move some ions here, some ions here, and as this portion is refractory, the here will not generate action potential, but here is generate action potential. Action potential generate. So यहाँ से इधर गया, यहाँ से इधर गया, यहाँ से इधर गया, and this is how the conduction of the impulse occur only from one direction to the other direction. So it is always unidirectional because of its refractoriness. तो जो already depolarized हो चुका है, that portion is refractory to the subsequent action potential, and this is along the entire length of the axon action potential is propagated, and this type of the conduction is called as electrotonic conduction. So it never goes backside, it keep on going on the outside. Second thing for doing this unidirectional is synapse is also responsible, because synapse also conduct the impulse from presynaptic membrane to postsynaptic membrane. Reverse kabhi hota nahi, so there is a never reverse conduction of the impulse. So it is always in a unidirectional flow of the conduction. Now we'll see how this conduction occur in myelinated nerve fibers. Now, what is the difference between unmyelinated and myelinated? Myelinated nerve fibers, myelin sheath is firmly attached. This myelin sheath has been firm attached, and this portion of the nerve fiber is never get exposed to the extracellular fluid. So as there is no extracellular fluid, intracellular fluid hai, but extracellular fluid hai, nahi hai. So there is no other pole, and that will make this membrane इलेक्ट्रिकली न्यूट्रल, बिकॉज कोई अदर एंड ही नहीं है. जैसे आप स्विच आपका होता है, अगर आपने एक पॉजिटिव वायर को हाथ में पकड़ के रखा हुआ है, बट इफ सेकंड बॉडी इज नॉट कनेक्टेड एनीथिंग, देयर इज नो अदर एंड वेयर इज दे हैज टू कंडक्ट. सो देयर इज अ no negative disbalance or electrical disbalance. So this portion of the nerve is electrically neutral. Now only site which is electrically active is a node of Ranvier. Now node of Ranvier, this portion of the nerve is exposed to the extracellular fluid. So inside is a normally negative, outside is a positive. Okay. Now once consider soma में continuous stimulus हो गया, the accumulated, and it generate the action potential in axon iliac. So now consider this is axon iliac. यहाँ पे action potential generate हो गया, inside positive हो गया, and outside negative हो गया. Now when all this happens, then these sodium ions will start moving from this portion to this portion inside the cell, and it will change the membrane potential of this nerve also. And by changing this membrane potential, it will generate action potential in the next node of Ranvier. Now when it generates action potential of the first node is abolished. Now here action potential only here. Now from here it also moves in this direction also, and opposite direction also. But opposite direction, it is refractory to the action potential. So action potential occurs in the next node of Ranvier, then it goes to the next node of Ranvier, and it is feel like the action potential jumping from one node of Ranvier to the other node, then other node, then other node. It is like a jumping of the action potential occurs. So conduction is like a jumping like of the conduction. That's why it is also called as a saltatory conduction. Saltatory means jumping type of the movement. जैसे आप सैक रेस करते हैं ना, कैसे आप जंप कर करके आगे जाते हो, सेम वे एक्शन पोटेंशियल इज जंपिंग. बिकॉज ऑफ दिस जंपिंग नेचर, नाउ इट प्रिवेंट्स और prevent the loss of the time. So यहाँ पे इतने 1 mm का ऑलमोस्ट एक नोड होता, एक माइलिन शीथ की लेंथ होती है 1 मिलीमीटर का. तो इतनी बड़ी लेंथ is prevented from generating the action potential, and from this portion immediately generate to the second potential that will increase the conduction velocity almost 550 to 100 times faster as compared to unmyelinated nerve fibers. And that's why myelinated nerve fibers conduct the impulses much faster as compared to unmyelinated. Because of this, it will keep on causing action potential every length, and that's why it take little time to reach from this portion to this portion. And that's why myelinated nerve fibers conduct faster impulse as compared to unmyelinated nerve fiber. Then come to the orthodromic and antidromic conduction. As we say, action potential is always propagated in one direction, and it's from soma, it goes to the axon. This is called orthodomic conduction, and if conduction occurs in opposite direction, usually in a sensitive nerve fibers, so it goes from the receptor to the soma, and that is called antidromic conduction. There is not much difference between orthodromic and antidromic. No, jumping will require comparatively very less energy. उसी पे आ रहा हूँ अभी मैं. I don't know slide है क्या? Okay. Now, what is the advantage of myelin sheath? Because it generates the action potential only in this portion, and this portion is devoid of generating action potential. So, energy expenditure by these myelinated nerve fibers is much less for conduction of the impulses as compared to unmyelinated fiber. So, it is also energy saver of the it is one of the energy saver mechanism. It has a high mileage as compared to unmyelinated nerve fibers. Okay. Now come to the conduction velocity. It is the rate of the impulse conducted from the one part of the neuron to the other part of the neuron. That is called conduction velocity of the nerve. And it can be as low as 0.25 meter per second to as high as 100 meter per second. So in unmyelinated, very thin unmyelinated nerve fibers, it can be very low as 0.25 meter per second, while it can be very high in the myelinated fiber. If it is very thick, then it can be as high as 100 meter per second. Apart from this, myelination sheath, axon diameter is also plays very important role in the conduction of the velocity. It's similar like that of the Ohm's law. Thicker the wire, better is the less is the resistance, and less is the resistance, faster is the conduction. Similarly, अगर एक्सॉन ठीक होगा तो एक्सोप्लाज्मिक रेजिस्टेंस बहुत कम होगा and conduction will be much much faster as compared to thin axons. And that's why the diameter of the axon is also very important. Next is the temperature. Within the physiological limit, if there is a decrease in the temperature, it can delay the conduction. Okay. Then, as myelination can increase the diameter of the nerve fiber, that increases the conduction. Second thing, it causes saltatory conduction, so it increases the velocity of the conduction because of these both factors. Okay. Now, depend upon the velocity of the conductions and all those things, nerve fibers are divided into different portions. So, if you stimulate a one mix now and record it from some distance away, suppose 10 centimeter or 25 centimeter away from the site of the conduction, then you can see split of the electrical activity in that conduction if you record at the little bit away in a mix now. And this type of the action potential is called compound action potential. Here, the one mix now has been stimulated and the impulse has been recorded little away from the stimulating electrode. Suppose this is the arm. Sorry. So this is arm, and here somewhere or elbow we are stimulated the stimulating electrode and we recorded somewhere. So इतने gap में हमने उस nerve को stimulate किया. So we get enough time, and if with that time if we record it, so it will record the different phases of the action potential. Depend upon now अभी आप बोलेंगे सर यहाँ पे इतना ज़्यादा इतना कम. This is not a action potential of one nerve fiber. It is action potential of the many nerve fibers. So it shows combined electrical changes of the many nerve fibers. And because of the different rate of the speed of the nerve fibers, different amplitude and different distance it has formed. So nerve which conduct an impulse very fast is referred as a nerve fiber. So these all three are the A fibers, and they are again divided into three groups: alpha, beta, and gamma. So alpha is one of the fastest nerve fiber, example of alpha motor neuron. And these all are examples of myelinated nerve fibers. Then alpha A beta fibers is also faster, but not as fast as the alpha. Then there is A gamma, which is much slower as compared to alpha. Then come to the much thinner but myelinated nerve fiber B, which has a very slow conduction velocity, which comes little after A nerve fibers. and then there is unmyelinated fiber, that is C fibers, which has much slower, and that will come much later. And the amplitude of also, because the content of the nerves of unmyelinated fibers are very less in mixed nerve, so the amplitude is also very low. And this is how the compound action potential can tell you what different type of the nerves contain in any mix nerve. Depend upon these different property of the nerve fibers are classified into different groups. So there are various different type of the classifications. Out of this, one of the important classification which internationally accepted is latest classification, which is described by the scientists Erlanger and Grazer. So there is a type A fiber, type B fiber, and type C fibers. Type A fibers are the fastest conducting nerve fibers, having a diameter varies from 12 to 20 micron, which is around thick. They are myelinated fibers, and they are divided into 4 different groups: alpha, beta, gamma, and delta. And they perform both motor and sensory function. Then come to another group of the fibers, that is type B fibers. These are myelinated nerve fibers, but having a diameter less than 3 microns, and their conduction velocities varies somewhere around 4 to 30 meter per second. And these are usually you will see in a autonomic ganglions and also some sensory fibers which coming from the skin and viscera, and also free nerve ending fibers. These are responsible for the pain conduction. Then come to the type C fibers. Type Cs are the unmyelinated nerve fibers, and which have the diameter some varies from zero point 0.4 to 1.2 micron. It has a conduction velocity which varies from 0.5 to 4 meter per second. And this usually you will see in a postganglionic autonomic fibers, then pain sensory fibers, and then fibers which carry from thermoreceptors and viscera. So this is a diagram which shows the different features of the latest classification, how different fibers will be there. So A fibers, alpha myelinated fibers usually forms the somatic motor fibers, and also conducted the proprioceptor from the muscle spindle. Like beta fibers, there is sensory fibers and which carries touch and pressure. MCQs में आएगा, इसमें से कोई ना कोई एक जरूर आएगा. Then gamma myelinated is usually from the gamma motor nerve fibers which supply to the muscle spindle, while delta myelinated fibers carries the pain, cold, and touch sensation. While B fibers, myelinated fibers are usually preganglionic autonomic fiber, while non-myelinated C fibers are postganglionic autonomic fibers and also carries sensory responses. And these are pain, temperature, and some mechanoreceptor, proprioceptor receptors. Now here if you see, the motor fibers are usually alpha and gamma are the motor fibers, while all other are the sensory fibers, while B fibers and C fibers are usually autonomic. So preganglionic are B fibers and postganglionic are C fibers. So ये थोड़ा ध्यान में रखना है. मोटर फाइबर्स अल्फा एंड गामा, बाकी सारे है तो पेन में सब उसमें देख सकते. स्लो फाइबर्स आर यूजुअली पेन फाइबर्स. अब इसमें भी जो डेल्टा फाइबर्स कैरीज द फास्ट पेन, while C fibers carry slow pain. When we'll get a time, if we'll talk about the pain physiology, that time we'll discuss about this delta fiber and C fibers, how it is helpful us to deal with the various pain. Then there another type of the classification that is called numerical classification, and this is we usually use this numerical classifications more of the for the sensory fibers. Motor fibers के लिए हम उतना numerical use नहीं करते, but to understand the classification of these two, we can relate with each other. So numerical classification, they enumerated in number of the Roman numbers. So type 1 fiber, type 2 fiber, type 3 fibers, type 4 fiber. Type 1 fiber again divided into type A and type B fibers, and these both are alpha fibers. A alpha fibers goes from the muscle spindle, and another type 1B fiber goes sensory fibers from the Golgi tendon organ. So 1A carries sensory from the muscle spindle, or 1B carries fibers from the Golgi tendon organ, and these both are responsible for the proprioceptive sensations of the muscles, and this has to be conducted very fast. That's why they are carried by A and B fiber or alpha fibers, because it is one of the fastest fibers. So when you are doing any actions, During that going actions, immediately information should go to the brain. That's why these are very fastly conducted. Then there is a type B fibers, which also carries sensation from the muscle spindle, but it is carries the muscle spindles different nerve ending, that is flower spray endings. Annular spiral, which when we see the muscle spindle structure, that time you'll realize. And apart from that, it also carries the sensation like touch and pressure. Here, the touch sensation, which carries by the A beta fiber, will also carries the sensation of vibration, because it is a very fast sensation to understand the vibration, and these are carried by this A beta fiber. So sometimes you might get question, vibration sense is carried by which nerve fiber, and आप पूरा चार्ट देखोगे आपको कहीं दिखेगा नहीं. So it carries by A type 2 fibers. Then come to the type 3 fibers. So this is A delta fiber, which correspond to latest classification, and it carries pain, cold, and touch receptors. Then come to the type 4, that is C fibers, and which carries pain, temperature, and other receptors. Now someone will ask, sir, आप B fibers नहीं है? As I said, कि numerical classification is exclusively used for the sensory nerves. And B fiber doesn't carry any sensation, so that's why it is not included here. Now, if you see, all these are the sensation carries by these particular fiber. And please remember these fibers. You might get MCQ or any questions regarding, because this has a various clinical significance. Why this has to be go fast and why this has to be go slow to perform our various functions more accurately. This conduction is very important. Now, simple, I will just give example. A delta fiber goes much faster, while C fibers are much slow. Now, what happens when you get any pain sensation? That pain sensation carries by both type 3 fibers also, type 4 fibers also. Type 3 fibers reach faster and goes, it is a has a low sensitivity with low intensity. It goes to the spinal cord and you feel that pain. But when it go reach there, it inhibit the type C fibers and reduce the conduction from the type C fiber, which is more definitive pain fibers, and which can give you exact idea about the intensity of the nerve. So आपको जो बहुत ज़्यादा पेन होता है, then it will stimulate too many type 3 fibers, and that will inhibit the type 4 fibers, and it causes natural analgesia. Similarly, if you stimulate the touch receptors or sometimes cold fermentation or hot fermentations, then also it stimulates the A receptors, and this A receptor will cause uh, pre-synaptic inhibition of the type 4 fibers, and that will reduce the pain. So आप जो बाम वाम लगाते हो, या आपको कोई आपके दादाजी नानाजी बोलते हैं मेरे पैर दबा दो बहुत दर्द हो रहा है, so actually you are doing this counter stimulus, and that counter stimulus will inhibit the pain sensations and prevent the pain sensation going to the brain. This is also called as a gate mechanism. So this is advantage of being slow fibers and fast fibers, so which can modify the sensations. Then this is also one of the common question asked in MCQs, susceptibility. So how the different fibers are susceptible depend upon the latest classification. We describe this. So you can HPL, Hindustan Petrol Limited. जब हम मसल स्पिंडल पढ़ेंगे ना साहिल बेटा, तब हम फ्लावर स्प्रे एंडिंग्स के बारे में बात करेंगे, क्योंकि पूरा एक क्लास जाएगा इसमें मसल स्पिंडल पे. आई विल मेक अ क्लास फॉर द मसल स्पिंडल ऑल्सो. That time we'll discuss about it. So you can make a HPL and see the most susceptible. So most susceptible HPL is a back, BAC. Okay. So hypoxia के लिए B fiber most susceptible होता है, pressure के लिए A fiber, and anesthetics के लिए C fibers. Now it is see how it is beautiful. For anesthetic, C fibers are very much sensitive. So आप कभी local anesthesia दे दो तो pain sensation सबसे पहले चला जाता है. C fiber conduct the pain sensation. So that will goes on. Normally हम anesthesia pain abolish करने के लिए देते हैं. So even with the small doses also you can lose with those sensation. While pressure sensation, you can realize how the pressure pressure causes A. A carries a motor sensation. So sometimes if you sit in a one position, आपको पैरों में चींटे आ जाती है. So that actually uh, uh, exaggerate your stimulus. So it start irritating your B fibers and C fibers, but it stop conduction through the A fiber. So it causes temporary paralysis of the muscles. Your muscles will not become active. that आप बोल देते पैर सो गया, so that must B fiber, A fibers get affected because of pressure, and this is how it will take little time to reactivate it. So this is also one of the type of the injury, but which we can regenerate easily. Now other factors are A, C, C, B, B, O3. Important is most susceptible, इस पे आपको हर MCQs आ सकता है. Susceptibility means आप उससे कितने जल्दी अफेक्ट होते हो. लोकल एनेस्थेशिया से सी फाइबर सबसे पहले अफेक्ट होता है एज कम्पेयर टू ए और बी फाइबर्स. ए फाइबर्स आर लास्ट टू अफेक्ट थ्रू द लोकल एनेस्थेशिया. वेल हाइपोक्सिक को बी फाइबर सबसे ज्यादा अफेक्ट हो जाता है एंड सी फाइबर सबसे लिस्ट अफेक्टेड रहता है. वेल इफ यू कम टू द प्रेशर, ए फाइबर इज द वन हु अफेक्टेड मच अर्लियर टू द प्रेशर as compared to other fibers. That is what mean by the susceptibility. Then come to the nerve injury. So whenever this occurs to the nerve injury, it disturb the functioning of the nerve. And how much the functioning of the nerve and disturb and all those things depend upon the what severity of the injury occurred to the nerve. So we can grade the nerve injury in the different severity. Depend upon that severity, time taking operation. Okay, जब हम local anesthesia देते हैं, suppose we are giving spinal anesthesia, we affect almost all fibers which coming to the spinal cord. So आपका sensory fibers भी affect होता है, आपके motor fibers भी affect होते हैं. That's why it causes complete paralysis in the जहाँ पे आप spinal cord दे रहे हैं वहाँ से नीचे तक का complete paralysis हो जाता है. When you are giving general anesthesia, we completely affect the central nervous system. So not only your sensory fibers, motor fibers also goes, but it also reduces your vital function. आपका respiration बंद हो जाता है, cardiac activity बंद हो जाती है. Almost person like a death. उसको anesthetic is like a magician. वो आपको मौत के पास लेके जाता है और वहां से बाहर लेके आता है. Almost like a control poisoning की तरह वो देता है and completely depress whole CNS. These are different. I am talking about local anesthetics. Local anesthesia हम कब use करते हैं? When you are giving stitches, or when you are doing some simple procedure, राइल्स ट्यूब डाल रहे तो then you will apply the local xalocan jelly to that area and then you put. So this when you are applying locally this anesthesia, that time we call it as local anesthetic. Good example is xalocan, or also called as a lignocaine. And these will affect the C fibers first and then they will affect the other fibers. So आपके पेन सेंसेशन सबसे पहले कम जाता है. That is what we want. जब मैं तुम्हें स्टिचेस दे रहा हूँगा तो मुझे आपके ए फाइबर बी फाइबर से कुछ मतलब नहीं है. आपके मसल्स कितने एक्टिव है, कितने रिलैक्स है, दैट डजंट बॉदर मी. आई वांट योर कोऑपरेशन. You allow me to stitch your wound more properly. And when you will cooperate, when there is a less pain or no pain at all, and that occur when you are applying local anesthesia. Okay, understand? So there is a difference between surgical anesthesia में हम either we give spinal anesthesia or we give general anesthesia. But when you are doing small surgeries like stitching and all those things, that time we apply local anesthesia. Okay. Now come to the nerve injury. So depend upon the different graded of injury, there are different type of the response. So first injury, which is very mild type of the injury, is a first degree injury where no anatomical disturbance, there is no actual damage occur. It is just causes transient loss of the function. जो हम पैर सोना बोलते हैं ना, that is one of the first degree of the injury, which is usually caused because of mild pressure on the nerve, and it will recover within few minutes to hours and almost attain complete normal functions within few days. Once you remove that pressure, depend also it also depend upon कब तक उस पे pressure आप दे रहे हैं. The second degree of the injury where the endoneuronal tubes, okay, where this endoneuronal tube will remain intact. So it can cause damage to epineurium, perineurium, but endoneural rim will remain intact. It can occur because of either severe pressure or prolonged pressure on the nerve, and the nerve fibers will get severely damaged. And it also started developing degenerative changes in the nerves. But regeneration is very much possible because endoneural tube is almost completely intact. So through this endoneural tube, regeneration is possible. Then come to the third degree of the injury where the endoneural tube is disturbed. So there is damage occur to the this endoneural tube. It will get damage to the endoneuronal tube and it will cause degeneration of the nerve fibers. Chances of regeneration are 50-50 in the third degree of the know how approximate the two nerve endings are close to each other. Fourth degree, when there is a complete damage, severe damage occur to nerve fibers, endoneural tube will be complete damage, nerves, fasciculars will be completely disorganized. That type of the injury is called a fourth degree of the injury. And fifth degree of injury when two nerve endings completely separated from the each other. It is like surgically हम cut कर देते दो nerve fibers अलग हो गए. So in this condition also degenerative changes occur. It will occur very early and regeneration is nearly impossible in fifth degree of nerve injury. Now what are the degeneration means what occur? So degeneration occur, one is occurring to the distal end of the axon. That is called anterogate degeneration or also called as a Wallerian degeneration. And the degeneration changes occur with the proximal end of the injury. Then we call it as a retrograde degeneration. So suppose this is a now यहाँ पे कोई axon है and suppose यहाँ पे injury हो गई. So whatever changes occur to this portion is called anterograde or Wallerian degeneration. And this is a common question asked Wallerian degeneration. Whatever changes occur to the body and proximal end is called retrograde degeneration. Okay. Okay, now we'll see the changes will occur to the distal part or Wallerian degeneration, how it occurs. So once the injury occurs, suppose this is the site where the injury occurs. Once the injury occurs, first thing which will happen will causes a swelling in the distal parts. So this whole part will start getting swell. Okay, and once the swell will get and it will start breaking this axial cylinder slowly start causing breakage of this axial cylinder and granular debris will be keep on forming. So up to E stage is a stages of degeneration. If you see the myelin sheath, there will be disintegration of the myelin sheath and fatty tissue is formed and it will start with the eighth day of the injury and the degeneration will continue till the 30 to 35 days after injury. And whole myelin sheath will form with a ghost tissue and which contain the all fatty droplets or cholesterol droplets within the that myelin sheath. Then come to the neurolemal sheath, which is formed by the Schwann cell itself, and this will be completely intact and the number of the Schwann cells will keep on multiplying. अभी एक ही cell wrap हो रही थी ना, there are many Schwann cell will be there which is not wrapped and it will form along the length of this neurolemal sheath. This increased number of the macrophage cells in the axon and that start removing the debris which causes because of degeneration of axon or myelin sheath. All these cellular debris will be removed and it will start making this neuronal tube completely empty and that is called ghost tube formation. Then come to the proper Schwann cells. This Schwann cell will start proliferating and completely entire this tube will be filled by the Schwann cells. So Schwann cell will be completely fill this neuronal tube and this membrane will continue intact and it provide the nutrition to the neuronal cells and also provide the guidance for the regeneration of the nerve fibers. हम regeneration में देखेंगे क्या क्या changes होते हैं. Now come to the anterogate changes occur into the nerve fibers. So it is occur to the proximal end, that is in the body and axons. So what are the axon remaining in anterior part will have similar changes that occur to the distal end. So they are the similar changes, but the body also shows the changes and the proper body it shows to start with the depend upon the injury. You can start within 48 hours and continue that changes up to the days of the 15 to 20 days after the injury. And first change which occurs is disintegration of the initial bodies and dissolution of the initial body. So there is complete removal of the the cell body. Then Golgi apparatus, mitochondria, and neurofibrils will also start disintegrating, fragmented, and slowly disappear from the cell body. This cell body will start increase in the size because of it draws the fluid from the extracellular fluid, and cell will start becoming swelled. It will become more spherical, and nucleus will of the nucleus center में था, the nucleus will start dispersing and send it to the periphery. And if injury is very severe, sometimes nucleus will removed out of the cell body. And if the nucleus is removed out of the cell body, the regeneration of that neuron is not possible. The neuron will completely disappear, get atrophied, and it will removed from the body. If nucleus remain inside the cell body, then chances of regeneration is possible. Now come to the regeneration. So regeneration means reappearing of the neuron. So what are the regeneration occur and how it occur? It depends upon the various factors. One is the type of the injury. If it is crush injury, then regeneration is more likely to occur. Yeah, neuron get atrophies. Atrophy means decrease in the size of the neuron or decrease in the function of neuron. And that is called atrophy. Hypertrophy, increase in the size of the cell. Okay. If cut injury is there, then we approximate this both neuron and cut injury to each other, then it can increase the chances of the regeneration. While crushed injury will reduce the chances of regeneration. If gap between the two ends will more than 3 mm, then there is chances will be decrease, even if it is in the same line. If the two nerves are close to each other but they are disturbed and they are not in the alignment, then also regeneration is less possible. Presence of the neurolemma sheath is very important for regeneration. If there is no neurolemma cells, then regeneration is not possible. So in unmyelinated sheath, there is no neurolemma sheath, so there is a regeneration is not possible. Second important factor, presence of the nucleus within the body has to be there. If it is not there, then regeneration will not possible. If it is present, then regeneration is possible. And it also factor one of the important is grading of the injury. So first, second, third grade of injury, regeneration is more likely to occur, while fourth, fifth, it is less likely to occur. Then what are the regeneration changes occur? So ghost tubes appear. So the changes occur like a proximal end of the this injured fiber. This proximal भाऊ हा भाऊ अर्ध्या तासात फोन करतो मी तुला मी क्लासमध्ये आहे भाऊ आवाज नाही येते मी अर्ध्या तासात फोन करतो So first thing which occur and which indicate that there are chances of regeneration is the formation of the or extension of the axon stump and which come out of the proximal neurolemma tube and it will extend outside. So that is the first sign which shows regeneration can be possible. Once it comes out, it will hundreds of the branches will form and will spread those fibrils in all different directions. And this function of this fibril is to find the our neurolemma tube. Now, Schwann cell, which is distal portion of the axon, will guide these neurofibrils and waiting for these fibrils to enter into that neuronal tube. Once this fibril enter into the neuronal tube, this Schwann cell will provide nutrition to this neurofibril, and that one fibril which enter will entirely grow while all other neurofibrils will degenerate. So जो एक enter करेगा वही grow होगा. Other neurofibrils will be rapidly degenerate and that will fastly start growing and it will completely fill the axon tube, neurolemma tubes and continually and get to the next end of the nerve fibers and there it will give uh, multiple branching. Once this axon will be established, and now there will slowly myelination will be start forming, and it will get completely myelinated within 1 year to 2 years. So it will take cell almost 3 months to form the complete axons, and it will take another 1 or 2 years to form complete myelination. But regeneration is possible, and there are many other factors which are responsible. Later, what are changes occur in the body? The initial granules will start appearing, and then it is followed by the Golgi body will start appearing in the cell body. Cell will start losing the fluid and regain its normal shape. Then nucleus occupies the central positions, and within 20 days to 18 days, it will completely come back to its original size and shape. So this is an example of injured nerve, and this is an example of normal cell. Okay. Then there are various factors which are responsible for the regeneration. One, as I say, neurolemmas tool. Apart from this, the neural growth factors. So there are various growth factors released by the cell, and this is called neurotrophins. And these are also responsible for the regeneration of the cells and also formation of the axons. So these are called neurotrophins, and they are also called the neural growth factor. They promote the regeneration of sympathetic nerve, other sensory nerves, also 2A, B, and alpha-synucleic made up of these polypeptides, and it causes the promote the generation of sympathetic and some sensory nerve. Then there is a brain-derived neurotrophic factors that promote the growth of the various sensory nerves. The neurotrophin 3, which promote the growth of the various mechanoreceptors, and then neurotrophin 4 and 5. These also promote the growth of the various factors. There are other growth factors also present, like cellular neurotrophin, leukemia, insulin-like growth factor, and all those things. But still, research is going on, and we are not very much available of the various neurotrophins. If we could able to find, then it can possible to treat the various degenerative diseases which occur in the brain. If we could able to find good neurotrophins, and which can able to regenerate the degenerated neurons. That's all about the nerve physiology. Any questions? Any doubt?